Um, Alrighty, so I'm excited to introduce to you our next fantastic team named the Health Impact Team. The team is composed of Tasvik, Emma, Jeremy, Sador, Adeline, and Tuba. Their challenge was to improve health literacy in underserved communities. The team addresses this challenge by creating in-person workshops, supplementary handbooks, and online resources that help Black and South Asian community members make educational medical decisions about cancer screening based on credible research. So I'll just play their 2-minute pitch video right now.
The COVID-19 pandemic brought the need for health literacy and disease prevention to the forefront and shone a spotlight on an issue that has been affecting underserved communities for a very long time. In Canada, Indigenous, Black, and South Asian communities are subjected to low health literacy rates and inaccessible healthcare, leaving community members vulnerable to contracting illness and the suffering associated with it.
Factors such as socioeconomic barriers, digital and language divides, cultural and historical factors, along with the lack of accessible resources, all play a role in the development and maintenance of health literacy gaps experienced by the communities. Although we cannot change how healthcare is administered in Canada nor erase the nuances behind its inaccessibility, we believe that trying to improve health literacy and providing access to available resources will equip community members with the knowledge to make responsible decisions regarding their personal health. The Health Impact Team is working to do just that. Our team challenge this summer was to create tailored educational modules for Black and South Asian communities here in Ottawa with the hopes of improving health literacy. Our intentions were not to foster a sense of trust in the healthcare system, but rather to deliver important health information to community members while maintaining a healthy and respectful learning environment.
To achieve this, the team focused on setting the foundations of our project through 3 deliverables. 1. The design of a workshop on general cancer screening meant to encourage community members to participate in screening and prevent late diagnosis. 2. Supplementary handbooks summarizing the workshop and providing information on resources to increase accessibility. And 3. A social media page to promote our content and render our curated resources available online.
Healthcare in Canada is said to be universal, easily accessible, and administered equitably despite the frustration and concern felt by our community members. Although we can't revolutionize the healthcare system, we hope that the steps we took this summer will propel us to greater strides in years to come, helping us make our impact on community health.
Thank you for that awesome pitch video. I will just pass it off to Tasvik to continue on.
Hi, so I'll start us off here. The Health Impact Project is a student-led initiative which aims to improve health literacy in underserved communities and to empower members to make educated healthcare-related decisions based on peer-reviewed research. Health literacy, in this case, encompasses providing info on treatments like vaccines, medical literacy, and other culturally stigmatized topics. Next slide, please. In terms of our team motivation, from our personal experiences and research, we found that there were discrepancies that have unfairly affected underserved communities. Next slide, please. Okay, so for example, cancer. It's among the top 5 diseases that disproportionately affect Black women. More specifically, 40 to 42% are more likely to develop breast, cervical, or ovarian cancers compared to the rest of the population. This gap is found to be as a result of inaccessibility to resources, lack of data connecting health and ethnicity, and several other factors, including the lack of trust in healthcare, which seems to contribute to the lower rates of screening for these types of cancers. Along with this, the general stigma with getting screened for gynecological cancers and overall lack of accessible information regarding them. This shows that there is a need to provide information and to improve health literacy regarding cancer and how to detect it early. Next. In the vein of cardiovascular disease, the South Asian community in Canada have shown to have a noticeably higher risk of developing heart diseases, diabetes, or hypertension, which is a result of multiple factors, one of them being a diet change, perhaps. as a result of immigration and acculturation to Western lifestyles, leading to a higher increased intake of high fat and convenience food, which this phenomenon is also seen in Chinese immigrants as well. However, on top of that, South Asians also have genetic factors in play that increase the risk of diabetes, which naturally in turn promotes heart disease, which makes them a high risk group. They're more famine resistance genetically as a result of past colonialism, making your body store more fat, and which increases the risk of heart disease. But considering this, it's evident how tone deaf it is for nutritional guidelines and most experts to simply say, eat healthier, do more exercise. So to truly benefit these communities, they need to know these factors unique to themselves, and as such, they can make nutritional decisions better catered to their own body. On a more personal note, there are family members of our teammates who don't have accessible info regarding healthcare, and as such have been lost as a result. For example, family members missing signs and symptoms of early stage cancer, or risking COVID due to a hesitancy towards vaccines. And as a result of all this, we see that there is a significant need to help improve health literacy and provide info surrounding healthcare for communities that lack it the most. There were three deliverables that we worked on over the summer, three tangibles to be specific. The design of the workshop, which we decided to be centered around general cancer screening, the supplementary post-workshop handbook to be given following the workshop, and our social media presence. The purpose of the workshop was to encourage community members to participate in screening. It focused on discussing topics like self-examination, dealing with cancer, patient advocacy, and available resources for financial and emotional support. This is tied to our second deliverable regarding the handbook. In this handbook, we created a summary of the workshop to enable participants easy access to all the info we give, so it won't simply have to be in their memories. They can have easy access to it following the presentation. And alongside this, there is a small list of resources that was made available should they ever require more information or simply wish to help cancer support foundations. Our last deliverable was focused on and making our social media presence known. We focused on accomplishing it by way of making and scheduling our introductory posts and mission statements centered around our team. And with this deliverable, we created a design for a logo that is both simple but also aesthetically pleasing.
So before we begin, it's important to mention why we chose to do a workshop and on cancer screening at that. So as mentioned before, Black women are disproportionately affected by cancer, but that can extend to the community as a whole and other underserved communities as well. This can be due to general stigma behind getting screened for cancers in the reproductive organs like cervical or testicular, or even available resources being tailored for specific communities. An example of this is skin cancer, where most diagrams are of growths on white skin. So growths and signs of cancer can look very different on different skin tones. And when resources are curated to only one, our other communities find themselves unable to notice the signs on their own body. So this is why we chose to discuss cancer screening in our workshop, to help provide more details and resources that would help bridge that gap, whether that be providing links to screening videos on different skin tones or discussing the importance of HPV vaccines to cervical cancer. And with regards to why this method of delivery specifically, since in-person workshops would take place in a setting familiar to community members and be interactive to mimic a classroom experience, it would maximize learning and comfort. We also felt that we'd be better able to communicate our project's purpose and our intentions face to face instead of like behind a screen. Next slide. So in terms of how we developed the workshop, we began with creating an outline to organize and rationalize the topics we wanted to include. So if this is a workshop on general cancer screening, is it worth going into the details of what cancer is and why it occurs, or rather to focus on the importance of self-examination and getting screened? This step was especially important because we did not want to overwhelm listeners with unnecessary information and take away from the general message of the workshop. From there, we conducted the research, focusing on simplifying the language and using relatable analogies to better communicate complicated topics. For example, we described a cancer cell to be like a car without its brakes. It's a simple analogy, but one that conveys the main point. Cancer is an uncontrollable cell and extremely dangerous to your health. Additionally, at this stage, we organized how we wanted to run the workshop. So instead of a monotonous lecture, we wanted it to be an interactive presentation meant to involve community members in discussions on their personal experiences, ultimately to enhance the quality of the learning environment. This was critical to our purpose and overall approach, as a direct lecture would be tone deaf and play to a sense of saviorism that is found among some non-for-profit groups. We wanted to create that sense of community and help members validate their frustrations and concerns with healthcare, realizing that they are not alone. Furthermore, even if we have some team members that can, let's say, relate with the experiences of community members, we still cannot assume that we know everything. As such, these discussions will help with improving the quality of our future projects, pointing out some gaps and sentiments we might have missed, basically allowing us to get data from communities directly. And some of the questions we created were, what health topics have you had difficulties discussing within your community and healthcare providers? Or another one was, what challenges have you experienced in terms of accessing healthcare services? So as you can tell, these are like broad questions meant to facilitate a discussion. There is no exact format as to which questions we wish to ask. Instead, this depends on the audience and how open they seemed with previous questions, and maybe use specific questions to extract even more information. Next slide. So for the post-workshop supplementary handbook, which was our second deliverable, we divided it into two components. One being a summary sheet, which would give access to necessary information from the workshop, and two, a resource sheet with the names, addresses, websites, or even contact info of several resources for mental health support, financial support, and even just online doctors and local community centers. This was created to close the digital and knowledge divide so that community members can access information without requiring their own research or digital fluency. Although the resources we provided are not specifically cancer related, they offer support for factors that play to existing gaps. For example, over 1 million Ontarians are without access to family doctors, which hinders screening rates and diagnosis. Many people don't have a reliable medical professional to ask about preliminary concerns and often resort to the emergency only when their health feels noticeably compromised, likely because the cancer has worsened. In terms of its development, this deliverable was an extension of the first. It required compiling information, summarizing it to key messages, and formatting it to create the summary sheet shown on the slide. You can see how simple the summary sheet is, and it only contains really like easy to follow instructions on self-examination or just an image, and only mainly highlights the specific points of or like take-home messages. The resource book as well contains direct information on resources, which also includes simple descriptions. Next slide. So finally, the social media page was meant to promote and give digital access to our content. This deliverable mainly required content creation and setting up the social media page. Our first step, however, was designing our team logo for the purposes of our future brand. So shown on the slide, you can see it's simple and easy to follow in the yellow, orange, and red. Easy to remember, sorry. And on the slide, there's also a screenshot of our page. Although there's only one post as of now, we do have a posting plan for September when we continue this project. And that includes posts on free mental health resources, online doctors for those without family physicians, and even dedicated posts related to our cancer workshop directly. Next slide. So the Health Impact Project was to create tailored educational modules for underserved communities with the hopes of improving health literacy while maintaining a healthy and respectful learning environment. To tackle this, we completed 3 deliverables this summer: the design of our workshop, a post-workshop handbook, and our social media page. Although it may seem small, the summer is full of steps integral to the foundation and long-term success of our project. Next slide.
So this summer we learned a lot in both expected and unexpected ways. To start, we learned about building and maintaining a team dynamic in which we support each other's learning and growth while completing tasks. And some of our members have worked in teams where the leaders are delegating tasks while others complete the assigned tasks. So breaking out of those roles and working equally on shared goals was very new to some of us. We also learned communication skills when discussing our opinions on these goals and project plans, and we learned how to facilitate each other's learning while also pursuing learning opportunities of our own. We also learned a lot about project design. When we initially formed our team and started the structure of our project, we wanted to conduct outreach, find interest, and then build learning modules from there. What happened was we started outreach and research into topics in community centers, and we learned that this approach was not effective for what we wanted to accomplish. since it would leave us looking into broad topics, waiting around for responses from outreach with really nothing to show from our time. So instead, we started looking into topics that needed to be addressed based on research in which certain communities were more affected than others. In this research, we narrowed down our search and started designing a workshop with plans to do outreach more once we had solid material to offer, rather than just an idea. This has proven to be much more time efficient and also a more effective approach overall. We also learned more technical skills like expressing information in more common terms, cutting out jargon. This is a new skill for a lot of our members since we do most of our written communication in academic settings. We're used to using terminology specific to those settings. Another skill that our team members learned and expanded on this summer was researching in real world situations. We compiled and analyzed a lot of research to find topics that should be addressed in our workshops and which communities were affected by them. So we also expanded our critical thinking skills when analyzing for credible sources and unbiased statistics. Next slide, please. In terms of immediate impact, our work will provide community members with access to information about the topics we cover, like general cancer screening, as well as supplementary information about resources associated with the material, like financial support for cancer patients and their families, or groups that provide more information for future questions they may have. Long term, our work will give community members the resources and knowledge to make informed decisions about their health and will improve health literacy, making the healthcare system more accessible and less daunting to individuals. We also plan to put an emphasis on self-advocacy, including skills involved in this and overall building confidence in medical settings. Equipping community members with the appropriate knowledge and giving them a chance to ask questions will empower individuals to stand up for themselves and their health, as well as encouraging them to seek the support they need when they need it. Next slide, please. In the future, we plan to branch out to pursue other topics, as well as offering our workshops to more communities. Our immediate plans following the summer are to present the workshop that we have designed, as well as to expand our social media presence. And then from here, we plan to expand our work to topics outside of general cancer screening. So from research, we see health literacy gaps in multiple topics, such as cardiovascular health, mental health, reproductive health, and so on. For each topic, what we'll do is we'll gather research to find what subtopics should be covered in our work. And then from there, we'll design and present more workshops. In terms of the future of our social media, we plan to post condensed versions of key material covered in the workshops, as well as other information. We also plan to register our team as a club with the University of Ottawa, opening our team up to more members, as well as adding a bit more structure. And overall, we just hope to see our project grow and expand from here. Next slide. So thank you all for listening, and we'll open the floor up to questions.
Good job, everyone. I thought really great presentation, and I really like the fact that although it's driven by like past experiences, which apologies that occurred, but it's you're not just assuming that whatever impacted, like your past. I don't know if I'm expressing this properly, but it's very empowering, and I'm excited to see and follow the club throughout its journey. Mike?
Yeah, I think this is fantastic. I'll echo Kira's comment there that it's great to see that you're taking such an interest in this and how well it's gone so far. I've kind of one little comment and then a question. So the first thing, I love that you didn't use the word educate or education once in that whole presentation, because I think we see this in a lot of the work that we do with our outreach. Is as soon as you're trying to educate somebody, then you're immediately creating that power imbalance, and those people are going to be way less likely to listen to you. I love that you're using words like empower and things like that instead. So kudos for that. I'm curious, in all the research that you did into these communities and the various kind of health inequalities and things like that, what do you think that the medical community or public health or things like that could do to improve access to things like cancer screenings and things like that? Because even, you know, you're providing tools for these communities to do things like self-examinations, things like that. But I wonder what you think the medical community could also be doing to better this for them.
I guess I'll go ahead and answer this. So actually, right before that, I wanted to say thank you for pointing that out, like about the language. I definitely had that issue from the start, and it was my partners that actually like told me that, you know, some of the way you're addressing this sounds sort of alienating. Like even saying like these communities and them versus us, it obviously feels alienating. So that was definitely something I learned over the summer. In terms of what I think that like the healthcare or even the public officials could do to help out with, let's say, I guess, accessibilities. For cancer screening, to be honest, I'm not quite sure on my own end, but one thing I did notice that during the pandemic, when it came down to like even booking your own appointment for vaccinations, that was very, I feel like the easiest way to access like those appointments were very like for those who are more digitally fluent. So who are able to use the Ontario website and wait in line and, you know, book their thing online. And then there was like the phone version, which I feel like was even still like it was a difficult experience even for those who are comfortable with it. And I say that from personal experience because with my parents, like they aren't really familiar with like using the internet and using the Ontario government website. And waiting on call on on wait was, I think like the wait time was almost like an hour and a half. So you can imagine that it's sometimes catered to like that ease of access for certain individuals. I think definitely maybe provide more like lines for like on call, like booking appointments and stuff like that, and just being aware of that like gap in digital fluency and even gap in knowledge, and acknowledging that there are people who feel uncomfortable going to like healthcare professionals because of past experiences. Will definitely be a first step that we can take. But in terms of specifics, I have to be honest, I'm not entirely sure.
Yeah, no, I think that's a great point. And actually kind of building on that, right? It's one of the things that we saw, maybe less so in Canada, but certainly in the States, there's a lot of community-based vaccination clinics, right? Mobile clinics, things like that, where people didn't have to go get vaccinated. The vaccine came to them. So I wonder if, you know, on top of, you know, better access to information, things like that, you know, maybe we can bring healthcare more into people's homes as opposed to, you know, forcing them to come to us. So yeah, thanks so much. I really appreciate all this work and also, you know, your deep thinking on it. So great job.
Thanks, Mike. A question from the audience. One, can you clarify to who your workshops would be presented to? And secondly, how did the project come about? And meaning, was there a client or did your group propose this as a project? If you can give a little bit more details on that.
Sure, I can hop on here. We will be presenting them to community centers and community organizations that already have an audience and who are interested once we do outreach. And as far as the project, we don't have a specific client. We did propose it on our own.
Thank you. Dennis?
Yeah, two things. You know, I love this project, and just because I know this is such a huge dilemma we face, and I'll tell you why. Well, there's many reasons, but one of the things that Mike and I work on is we try to build projects where we try to diagnose things in cancer, many diseases, complex diseases, but we also want to have a good, you know, prognostic journey. So treatments. What happens is when these communities are alienated at the screening phase, they're not even in the cohorts. And we know that in breast cancer, women from Southeast Asian communities are not even going through that journey because we don't have enough of them in the initial cohorts that we're doing treatments for. So, you know, bringing that to your story is, yeah, like, you know, screening and for diagnostics, this is great. But the more we bring people like this into these cohorts, you know, you should link maybe even to some things, because we always are trying to get more people into breast cancer stuff, because your diagnostic journey or your treatment journey will be a lot better when different so now when we develop projects, there has, and you know, we have this thing in Toronto where we have a really diverse community, so they just assume that's going to happen just in general. And I think that we have to be more active about different groups being represented. So we take these things and building those cohorts. So is there a way that you could sort of present that this is like there's value in getting a diagnosis, yeah, but that you're also going to help all the other people in your community is one thing. And so maybe finding some statistics out on specific cancers of do those cohorts, the treatment journey is better in these communities. Sort of getting that information might be scary, but also might be good as to why they're becoming part of something bigger than themselves. Secondly, what we find with buses running around to maybe different community festivals. Like I find a community center a little bit, and again, I don't know that somebody's going to come up to you in a bus at this over at Coxwell in Toronto at some festival, but to me, doing it different because your demographic, like you were just saying about a digital journey, social media for the people, I don't know who your demographics are. I know younger people are right here. I mean, I don't even have a Twitter account, and so to me, really, what's your demographic? Like, I know you need the whole demographic, and you need to start. But Mike and I did a really interesting project when we were trying to always do outreach. Why were we trying to do everybody? We have to focus, and sometimes the younger people can educate the parent. Well, there I use educate, but tell their parents because we can't sort of do that. So, who are your champions to become that in the community? So, anyways, it's a lot of I love this project, and I think that there's some things we could help maybe tell some of your story, some of these breast cancer things when we know the treatments for everybody is pretty equal. Knowing what that is helps them also come, right? So anyways, great so those are more just comments when you think about who your demographic really is, and those people will have to be messaged very differently.
Tasvik, did you want to comment?
Yeah, I did. I just want to add my own 2 cents. Yeah, I definitely think one of the issues, or I guess the challenges we faced with this project was definitely do we have that background or the experiences or that what's the word I'm looking for? I guess the certifications to address certain communities, right? So we addressed the Black and South Asian communities this summer because we had members from those communities that could tell us that direct information. But obviously there's a lot of stuff that's happening in the Indigenous communities that we would have loved to sort of address, but we can't because we don't have that, I guess, say in that as of now. And I definitely think once we present that workshop, we can get that data directly from the community members so we can better tailor it. And hopefully that would also promote our content. And if we can get these different community members from various communities, like the Southeast Asian communities, like you were saying, it'll definitely help us a lot. I also wanted to just add a little bit more to Michael's question and answer a bit as to how the project started. So this started sort of like a personal project between Emma and I. I proposed it to her because so my grandmother passed away in 2019 from COVID-19. And unfortunately, it felt very preventable because she was just very hesitant to getting the vaccine. And soon after she got COVID. So that was sort of the personal start. And when I told Emma, she also shared her own personal stories with it. And that's sort of when we started pitching it to MADS, getting more people onto it. And that's turned into our goal. In the future, we hope to really turn this into a long-term project and hopefully turn this into go to the global stage and go to the communities directly to sort of not only get information, but provide those resources as well.
Thank you for sharing, and I'm so sorry, and I honestly find it so empowering that you and Emma and the rest of your team are, you took this tragedy and you're going to impact so many people and going to help so many people. So it's truly, truly empowering, and thank you. Mads, did you want to?
Yeah, I basically wanted to highlight that what Tasvik just shared in terms of how this project came about, right? So it was a student-led initiative. Tasvik is a biomedical mechanical engineering student, and he participated last summer on our BioForge team, and which focuses on low-cost lab equipment using 3D printing and those sort of things. And I actually invited him to in as a team lead to continue that work, and Tasvik declined because he wanted to pursue a different project, and so instead, that what he Emma and him have organized is hopefully something that can grow in terms of getting students engaged in understanding some of those very important needs in our healthcare delivery. Like the data is kind of really stunning when we think about advanced technologies, for example, how much money we are investing in advanced research or advanced therapies, when actually 80% of our healthcare cost is spent on a small fraction of patients that don't have access to proper healthcare or family doctors, and for a number of different reasons. And often they will be ER patients with many comorbidities and social and mental health issues. So that's sort of like it's a very interesting, very important angle that I do think that we tend to forget in academia, because there's not much we can do about it, we believe, and I really think that's important. That I'm surprised that we don't have a student organization in our medical school or in our biomedical sciences program that actually does this kind of work, and actually do work with the homeless and stigmatized and underserved communities. We have lots of centers around Ottawa or in Toronto or any major North Bay, Thunder Bay, that there's a lot of opportunity to be engaged in this. And I'm surprised that nobody, that there's not a bigger push for that. And in that sense, Tasvik and Emma or others from the team, can you share with us, like you have done a lot of outreach and try to engage different organizations and community groups and programs in academia. Like the Global Health Initiative at U Ottawa. We also have an Indigenous health program that's dedicated to Indigenous medical education. And I was just wondering what kind of experiences you had, if there are any barriers there.
I definitely say outreach is a very difficult thing, especially when you're new to it. For us this summer, we outreach to international and global health at U Ottawa. There was also the community, like Centretown Community Center here in Ottawa, and the Lotus Group, which is a initiative working to reduce stigmatization regarding mental health in South Asian communities. So like reaching out to them, it's hard, and like sometimes they don't even reply back. I definitely say like a challenge or a barrier would be like, that disconnect, like not getting those replies back, even though how much we want to work. But I definitely say that's more of an issue with our end and how we're pitching the project, perhaps. I think there's a lot of resources at U Ottawa, and really like a lot of community centers and resources at U Ottawa that I think we can definitely reach out to in the future, especially when we start this club in the fall. And I actually want to hand the mic to Jeremy so he can answer the next question, because I feel like it relates well into it. So in the chat, it says, what are your plans for extension of this project in the future? Jeremy?
Hi. So yes, as Sasvik mentioned, we plan on creating a club centered around the Health Impact Project in the future, and the plan is from there is to recruit more members to, how to say, further expand the club, and from there start hosting new events, new workshops in community centers or even on campus to gain more feedback to the content that we're presenting, and in turn better our approach to the situation.
Thank you. I know we only have a couple more minutes. I was just wondering, how do you think your project would have been if instead of BioGroup Canada, it was BioGroup United States? What do you think, how do you think, because I know like for us, we have, our healthcare system. I don't know how much you know about the United States healthcare system, but I know you mentioned long-term, you want to see that global impact. So how do you think if you would have started in like a United States or similar country like that? And if you don't have an answer, no worries. I was just wondering.
I guess I can go ahead and answer that. Yeah, so
Oh, Tasvik, you just
sorry,
muted.
I definitely don't know a lot about the United States healthcare system and how that works, and maybe what are the barriers they face. Off the top of my head, and obviously don't take my words for a grain of salt in this case, but I definitely know that there's a lot of people who avoid going to, getting the healthcare that they need because of the cost that's, associated with it. And it is truly unfortunate. I bet there are some resources in the States that help those communities that are at highest risk or face the largest barriers. But yeah, I think maybe when we do start working on that global impact, our first step is definitely going to be looking at what that healthcare system is. And that's a good point, because obviously not everywhere is a universal healthcare system. Not everywhere has the same healthcare system. So knowing the pros and cons of each and how each works in each community is definitely going to be helpful.
Thank you. Yeah, I know it was a bit of I can see that I've paused, but can you still hear me?
Yep.
Okay, awesome. I just see my other screen and it's paused, so I don't know what's going on over there. But thank you for that question. I know it was kind of a tricky one. So I'm excited to see that health impact where your group is led. And if you could actually put that Instagram handle in the chat for everyone to follow, that would be awesome. So we'll ask one more question. Catherine, I think you were first. All right, you're up.
I just had a quick question. So like, let's say you had all this information at May. Like, let's say you could go back 4 months in the past. If you could redo this project, what would you do differently? Or would you do anything differently? Or would you just do exactly what you did?
I can hop in on that one. Definitely one thing I think we would do if we could redo it was we would start with the research sooner rather than looking into outreach. So when we originally started this summer, we went straight to looking for community centers and seeing who would be interested in having us do like a workshop there. But we had nothing to show. We had no research. We had no topics or anything like that. We were hoping we could get feedback from the community centers and say, like, maybe if there was a topic that they had noticed, we could bring. But we had not a lot to show. So in the future, or if we could go back and do it, definitely start with hard facts, like find the topics that needed to be covered and then present that. So a little bit backwards from how we started.
Jeremy, go ahead.
Yeah, I wanted to add in a bit to what Emma mentioned, since I was in charge of helping to do some research for the project. However, if I could give extra suggestions, I would probably tell my past self to add more statistics to back up the results I've been seeing on my reports, since it's one thing to read a report that states that something is happening, but it's another thing to see actual numbers presenting the situation as it is. So yeah, I would just throw in more statistics into my findings.
That's great. Thank you.
Thank you. Yeah, and thank you, everyone. Thank you, both teams at the very beginning for presenting. We are kind of aware that virtual meetings can kind of bring you some fatigue. So as a result of that, we're going to take a short 10-minute break. Feel free to get up, walk around, grab some fresh air, glass of water, and we'll kick back at 2:10.